Mr. O'Rourke, you're recognized.
Thank you, Mr. Chairman. Dr. Yahia, thank you for your testimony and for all of your efforts to transform the VA and improve access, quality of care, and outcomes for veterans. Earlier in the day, I was at a conference that Undersecretary Shulkin organized around preventing veteran suicide, which I would argue should be the priority. And the word priority means something, right? If you prioritize something, it puts that at the top of the list. So I understand that there are 12 breakthrough priorities that the Secretary outlined. I know there are a lot of moving parts, and there are a lot of things to improve and to work on. But what strikes me is that if we really think that we have a crisis in veteran suicide and access to mental health today, and it really requires urgency in resources, rethinking how we deliver that care and provide access to it, then we should really be organized around that. As you know, and just for the benefit of the committee and others who might not, in El Paso, which had the worst mental health access rates in the country and still struggles, I think we're third from worst today, which is an improvement. We essentially adopted a plan as a community with the VA and really with your help to prioritize access to mental health care and to try to prevent veteran suicide. And the idea is that as important as it is to see a podiatrist to get your foot fixed, or an endocrinologist if you have diabetes, or a dentist to get your teeth fixed, preventing veteran suicide is more important than all of those, and ensuring that if you go to the VA, it is I know this is a term of art, but it is a center of excellence for PTSD, TBI, those unique conditions associated with combat and service. And the VA has helped by piloting a navigator concept or care coordinator who helps if you have one of these unique service-connected conditions. You're seen in the VA by hopefully a world-class provider. If not, we're going to prioritize your care that's comparable to what a civilian would experience to the private sector. We've got great partnerships with Texas Tech, which is providing 5 psychiatrists so that we can expand capacity for care in the VA. And yet, we just looked at the numbers. You have 116, or Congress has authorized 116 mental health provider positions within the El Paso VA. And right now we're at 91 filled, which leaves us 25 short. And I would argue that 116 is probably too little to meet the demand that you have in El Paso. So what do we have to do? We've adopted the plan. We've got additional resources. If we are maximizing capacity in the community and implementing this transformation plan that you and the Secretary have introduced and touted, and which I'm a big fan of, why aren't we seeing better results in terms of meeting what I think is the single greatest crisis facing veterans in this country, which is 22 veterans a day taking their own lives? If that is truly a priority, why are we not beating all the bushes, taking over the airwaves to recruit those mental health care providers to communities like El Paso and others that are historically underserved, where I know for a fact, because I talked to the surviving family members, that veterans are killing themselves because they don't have access to mental health care. Why can't we hire those 25 positions? What's the holdup?
So I can't agree more with your sentiment. And as you know, many of the elements in the plan that you had for El Paso there's a lot of that in the plan that we presented for the entire VA. I think the part of the challenge is, as you know, to quote Secretary McDonald, the VA is the canary in the coal mine. I think we have to get out there and do more recruiting. I've been on a number of trips with the Secretary, speaking at grand rounds and various hospitals across the country, trying to recruit doctors, specifically mental health professionals and nurses, to the VA. I've done it by myself as well, and I think we need to do that. I think we have an opportunity as we start to kind of change the message a little bit about where VA is going.
Let
that
me
will get
let me
people
interrupt you just
excited to
because
join. Sure.
of very little time. My fault for taking too much time at the outset. But with the chairman's indulgence, could the VA instruct the director in El Paso, don't hire any more podiatrists or endocrinologists. You've got them in the community. You can refer them. That is a condition comparable to what the civilian population has. PTSD is very unique to veterans. Only hire your traumatic brain experts, your PTSD experts, your psychologists, psychiatrists. I recognize your canary in the coal mine analogy that medicine in America is struggling with this, and yet there's a way to resolve this with the current capacity. I know there is. I know there are psychiatrists and psychologists working in private practice who could be brought over to the VA with the right inducements, focus, and leadership. Are we going to see that this year?
Well, I know that, as you know, Gail Graham, who is working in El Paso at the medical center there, I think she's pulling out all the stops to try to recruit as many of those professionals as possible. I don't think the idea that, like as you mentioned, there's approved FTE slots for those. So I don't think that a podiatrist is standing in the way of a psychiatrist coming in the door.
I'm talking about a single-minded, almost exclusive focus on getting that up. Doesn't mean that other things are unimportant. All these conditions are important. I would just say this is the most important preventable way
I think
that
that's something
veterans are
that I
dying
think is
in our-
something
in
that we
our-
have to we should chat a little bit more about that. I think there may be some different tools that we can use.
Okay, thank you. Thank you, Mr. Chairman.